How to find a point in Colourpuncture so we know that we are on the point and we know that we are treating it well? There is a very simple answer to this question, and I'll just try to demonstrate it. And if there are any questions, then please ask. It's very easy for me to find the point now, but when I was starting in Colourpuncture, it was massive difficulty, and I was very afraid that I'm getting my points wrong. But guess what? There is no such a thing, because as long as you are in a proximity to the point, and you do your best to go with point sensitivity, which is the greatest strength of Colourpuncture. This is how we look for the point. You're going to be totally fine. So let's take a point which we don't use a lot in Colourpuncture. In Acupuncture, we use it in a very specific situation. This is just very easy for me to demonstrate. This is why I choose this point. So this point is called large intestine 2. This is the second point on the large intestine meridian. We start here. So this is large intestine 1. This is large intestine 2, this is large intestine 3, and this is large intestine 4, which we use in Colourpuncture and in Acupuncture a lot. So large intestine 4 gets all the glory of large intestine meridian pretty much. It has such a wide range of indication, and we basically rely on it when we want to address the meridian. But let's look at this point. Large intestine 2 is a water point on a metal meridian from point of view on acupuncture. In practical terms, it means that it reduces heat. This is the very beginning of large intestine meridian. And in the very beginning of any meridian, the chi, the energy, is very shallow. It's very accessible. It's straight under the surface, straight under the skin. So when we needle this point, we don't needle deep, obviously, because there is nowhere to needle. There is not so much substance. In Colourpuncture, obviously, it doesn't matter at all because we are not puncturing the skin, but it's important to know. So the chi here is very shallow. It just starts to flow along the meridian. It's sort of not very mature even. How we look for the point? We know that the point is right next to this joint in a direction of the tip of the finger. On the change of a skin color, there is a joint here, there is a bone here, and this is where point should be. Now, why I'm saying the point should be, I know where point is. This is where point is. But if you are in any doubt about how to find the point, what you need to know is this is where your point should be. And then you take your palpate, and this is why you have it in your Colourpuncture set, and you start testing. And you can do it right now by some demonstrating it, so you can see on a practical level how it is done. Then you can test in this proximity. So see my movements, they're very small, they're very tiny. So I found the point which is more sensitive than immediate environment. And this is my point. We need to stimulate the point before we do the color. I would always massage the point. We need to get the energy moving along the meridian. And then we need to address our informational flow with Colourpuncture. We found the point, we massaging the point, and then obviously because this is a bilateral meridian, we need to find the same point on the other hand. Very often when you can't find the point, you can close your eyes. And it seems strange, but it does help, because when we keep our eyes open, most of our input, sensory input, goes through the eyes because visual field has a priority. But as soon as you close your eyes, you will feel more sensitivity in the point. For a patient, don't close your eyes when you do it with a stick. With your fingertips, you can palpate, you can close your eyes, you can feel deeper. So I try this point, and I try the same point. And for me, right hand today, this point feels slightly more tender. When one of the bilateral points is slightly more tender than the other, we start with this point and we treat it in a cooler color. There are two options to treat large intestine meridian. One, we would treat red and green. So I would treat this point in green and this point in red. Other option to treat large intestine meridian is with colors yellow and violet, this complementary pair. So I'm taking my color violet and I'm treating this point with violet first. And I'm going to do just 5 seconds for demonstration, but in usual conditions, you do it from 20, 30 seconds up to 1 minute. The other side, I'm treating in yellow. Now, because I'm standing and I'm doing it for demonstration, I'm not very relaxed. But when you're doing it for yourself, what you need to do, you need to put some support to that hand, and you need to put some support for that hand, and then you need to be very relaxed if you're doing it for yourself. When you're doing it for somebody, obviously you also need to be more relaxed, because when therapist is tense, this tension you convey to your patient. When, for example, you're working for a long time on one particular part of the body, so classic example would be you're doing a lot of auricular points. What you can do, you can really support your elbow. If you have a wide couch, then you can support it by the end of the couch. If you have a very narrow couch, you can put it on your knees, on some pillow which you put on your knees. So bottom line is you need to be relaxed, or when you're doing it for yourself and when you're doing it for patient. When you're doing it for yourself, you need to keep the part of the body which been treated relaxed, but also your hand which holding the pillows relaxed. The same goes when you treat a patient. You need to stand in a good position and you need to be fairly relaxed. This is the best way to give a session because your calm, your centeredness, your balance, you will share with your patient. I'll give you another example how you can treat this point. So in Colourpuncture, we do actually treat this point very, very briefly. When we do treatment for colds and flus, here we're going into our red and green combination because red is the color which affects temperature. So red increases circulation, increases the warmth in the body. So red is not something that you use when person has fever, but when person is really, really weak and they have cold symptoms, what they need to do, they need some blood circulation, they need some peripheral blood circulation going in the meridian. So you need to warm it up and so for the body to respond. So what we do, this is the part of our treatment for cold in Colourpuncture. We stroke the line actually from large intestine 1 through the large intestine 2, through the large intestine 3, and to large intestine 4 in back. So point 1 along the bone, point 2, point 3, and point 4. We do it several times. As we are doing this, what we can do, again, you need to keep your hand on a surface when you do that, so you're very, very relaxed. So imagine I'm relaxed, imagine you're relaxed when you do it. As you are treating the line, and this is true with any line you treat anywhere on the body, as you treat the line, you're doing it slowly enough for the skin to absorb the light, but obviously you're not stopping as such at any given point. As you are stroking the line, you may come across some sensitive points. So for example, you stroke the line and you find point here, which is not an acupuncture point, but it is on the meridian you're stroking. You can stop on it for 5 seconds. This point needs more attention. It's tender. And then you carry on, come across another sensitive point, and you can stop on this point for 5 seconds. You can stop for 10 seconds, but more practical is 5, especially if there are several lines, it's a long line. You need to always stop where you started. So for example, when we treat this line and we start on large intestine 1, don't stop here, come back to this point. And obviously don't forget to treat another hand. So just to recap, so first you need to know where the point should be in theory. So in theory, our point should be somewhere here. There is another way to find this particular point actually. There are tricks how to find individual acupuncture point. With this particular point, it's at the end of the crease, and so you can go with this. You know where the point should be. The point should be somewhere here, and then you start with a very tiny, tiny little movements, and then you find the point. Very often, it's not even a matter of movement, especially for this tiny spot. It's a matter of angle that you choose. This is your point. The point that you're going to treat is more sensitive than immediate environment. And then again, if it's bilateral point, don't forget to check this side and this side. Find the most sensitive side, treat it first with the cooler color of the pair. And obviously be aware of color indications, because with color indications you can choose depending on what you want to achieve. Large intestine 2 point reduces the heat in the meridian. Large intestine meridian starts here with large intestine 1 and it goes up the arm, and then it crosses and its end on the other side here with large intestine 20, just next to our nostrils, both sides obviously. So the meridians run up both arms, they cross over and they end up here. If there is anything at the very top of the meridian, the very end, so something with the nose, something with the throat, something with the teeth, sore throat, dry mouth, toothache, this point will help. Also, because this is large intestine meridian and this is a point to relieve heat and to reduce heat at the meridian, it can help with things like constipation or lack of fluids in the gut and the large intestine. So those are indications. So go with the sensitivity. The point you're looking for is where it should be, and with your palpation, you will feel that this is more sensitive than its immediate environment. And this is how you know that you're on the point.